Not every risk shows up in a simple exam. Imagine a person who has a checkup and looks at their cholesterol results. They breathe a sigh of relief because everything seems to be within the normal range. They conclude that their heart is protected. But sometime later, this same person suffers a heart attack. How can this happen? Was the exam wrong? Does cholesterol not matter? The answer is that cholesterol remains extremely important, but it represents only one part of a much larger assessment. And the most forgotten point is precisely the one that many people never discuss with their doctor. This content is for educational purposes only and is not a substitute for medical consultation, diagnosis, or treatment. Do not discontinue medication based solely on this video. Evaluation must consider your age, medical history, symptoms, and individual circumstances. Before continuing, please like and share this video with someone who believes that normal cholesterol means zero risk. The first detail we need to clarify is the meaning of the word normal. You will find reference ranges for LDL, HDL, and triglycerides. However, being within that range does not automatically mean looking only at total cholesterol can hide important information. Two people can have the same total but different distributions. Even high HDL does not act as a shield capable of erasing high blood pressure, smoking, diabetes, or genetic predisposition. LDL particles participate in the development of atherosclerosis, which is the progressive accumulation of plaque in the arteries. Think of cardiovascular risk as a glass being slowly filled. Cholesterol may represent one part of that content. Blood pressure adds another part. Glucose, smoking, and family history add new layers. The sum of all can considerably increase the risk. Having a father, mother, or siblings who suffered a heart attack, stroke, or developed cardiovascular disease prematurely does not necessarily mean that you will have the same problem. However, this information may indicate the presence of genetic characteristics that do not appear in a superficial assessment. Therefore, it's not enough to tell the doctor that there are heart problems in the family. Try to find out who had the problem, what the diagnosis was, and at what age it occurred. A cardiovascular event that occurred early in life deserves special attention. Family history can also reflect shared tendencies, such as hypertension, diabetes, metabolic disorders, or certain types of particles present in the blood. The second major factor is blood pressure. Many people have their cholesterol checked every year, but go months or even years without properly monitoring their blood pressure. Hypertension often doesn't cause clear symptoms. A person can feel well and still have elevated blood pressure for much of the day. Over time, uncontrolled blood pressure increases the strain on the heart and promotes damage to the artery walls. When combined with smoking, diabetes, or lipid abnormalities, the risk can become much greater. Therefore, a single measurement doesn't always tell the whole story. Depending on the case, a healthcare professional may recommend repeated measurements at home or specific follow-up care. Glucose is another essential point. Diabetes and prediabetes can increase cardiovascular risk even when the focus is solely on cholesterol. Elevated glucose, insulin resistance, and other metabolic changes can affect blood vessels, kidneys, and the heart. This is why a preventive assessment may include blood glucose, glycated hemoglobin, kidney function, and other data. Now we need to talk about cigarettes. Some people believe that smoking a little doesn't pose a significant threat when cholesterol levels are normal. However, smoking damages blood vessels, promotes atherosclerosis, and increases the risk of heart attack. Frequent exposure to secondhand smoke should also not be ignored. Quitting smoking is one of the most important steps for cardiovascular protection. For those who face difficulties, there are support programs and treatments that can be guided by healthcare professionals. A sedentary lifestyle can also act silently. Spending many hours sitting and engaging in little physical activity can contribute to high blood pressure and poorer glucose control. The World Health Organization generally recommends between 150 and 300 minutes of moderate intensity physical activity per week. Prioritize your health today. Small changes lead to a stronger heart for a lifetime. But that doesn't mean a sedentary person needs to start intense exercise immediately. Walking, dancing, cycling, more active housework, and other forms of movement can contribute. Those with heart disease, physical limitations, or chest pain should talk to a professional before significantly increasing their exercise intensity. There's also the issue of inflammation. Some chronic inflammatory diseases, such as rheumatoid arthritis and lupus, can increase cardiovascular risk. In specific situations, the doctor may consider tests, such as high-sensitivity C-reactive protein, to help refine the assessment. However, it's important to understand that this test doesn't directly show if an artery is blocked. It can also be affected by infections. Therefore, it shouldn't be interpreted in isolation or used as a home test to predict a heart attack. And now we come to the point that many people never discuss with their doctor, lipoprotein A, also called LPA. This is a type of particle related to lipids, whose level is mainly determined by genetics. A person can eat well, exercise, and have seemingly controlled LDL, but still have elevated LPA. The standard cholesterol panel usually doesn't report LPA because it needs to be specifically requested. The 2026 Cardiovascular Guidelines recommend considering measuring it at least once during adulthood. Because levels tend to remain relatively stable, it's usually not necessary to repeat the test frequently. Having elevated LPA does not mean that a heart attack will certainly occur, nor does it mean that everyone should panic or seek miracle cures. This information helps the doctor to more accurately assess the risk and control modifiable factors like LDL and blood pressure. In some people, another test that may be considered is apolipoprotein B, known as ApoB. It helps estimate the amount of potentially atherogenic particles circulating in the blood. It can be especially useful in people with diabetes, elevated triglycerides, metabolic disorders, or kidney disease. This doesn't mean everyone needs to have ApoB, C-reactive protein, LPA, and multiple imaging tests. The choice depends on the clinical context. Ordering too many tests can lead to costs, anxiety, and misinterpretations. When there is still doubt about the true level of risk, the doctor may consider a coronary calcium score. This is a CT scan that looks for signs of calcium associated with atherosclerosis in the arteries of the heart. This test is not automatically indicated for everyone and should not be used to assess emergency symptoms. It is usually considered when the risk is in an intermediate range, and the result can truly change a preventive decision. The most recent recommendations also emphasize tools that calculate overall cardiovascular risk over 10 and even 30 years. These calculations can combine age, blood pressure, cholesterol, smoking, diabetes, kidney function, and other factors. They don't predict the future with certainty, but they help professionals and patients make more personalized decisions. At your next appointment, instead of just asking, "Is my cholesterol normal?" try asking, "What is my overall cardiovascular risk? Is my blood pressure really under control? Are my glucose and kidney function adequate? Does my family history change my risk? Should I measure LPA at least once? Would ApoB make sense in my case? Is there any indication for additional testing, or is it best to monitor traditional risk factors?" And here's the golden tip from this video. Don't just look for a reassuring number. Try to understand the whole picture. A cholesterol level considered normal is not an absolute guarantee. Just as an altered result doesn't mean a heart attack is inevitable. The goal of prevention is to identify risks, control what can be modified, and make decisions together with a professional. It's also important to remember that prevention and emergency are different situations. Pressure, tightness, or burning in the chest, pain that spreads to the arms, back, shoulders, neck, or jaw. Shortness of breath, cold sweats, nausea, dizziness, or feeling faint can be signs of a heart attack. Women, the elderly, and people with diabetes may present with less typical symptoms. If you experience suspicious symptoms, don't wait for your next medical appointment and don't try to solve the problem at home. Now you know the detail that is often left out. Cardiovascular risk cannot be contained in a single line from the lab. It is the result of the interaction between cholesterol, blood pressure, glucose, genetics, habits, inflammatory conditions, and metabolic health. Taking care of your heart doesn't mean living in fear. It means replacing the false sense of security with information and responsible prevention. And here's today's golden tip. At your next appointment, ask, "What is my overall cardiovascular risk?" Bring information about your family history, blood pressure, blood glucose levels, smoking, and physical activity. Remember, your heart isn't protected by a single number. True prevention begins when you understand the big picture. Comment below if you were familiar with lipoprotein E. Share this video and keep following for science-based health information. See you next time.